Imagine this moment. You are sitting peacefully at home, watching television, drinking tea, or perhaps walking in the park. Suddenly, you feel a strange pressure in your chest. At first, it feels mild, like someone is placing a heavy stone on your chest. You ignore it, but slowly the pressure grows stronger. Your breathing becomes difficult. Your arm begins to ache. Sweat appears on your forehead even though the room is not hot. Within minutes, your body is sending a powerful signal that something is terribly wrong. This could be the beginning of a heart attack. Every year, millions of people around the world experience heart attacks. Some survive and recover fully, but sadly many lose their lives because they did not recognize the warning signs in time. The truth is that a heart attack rarely happens suddenly without warning. Our body often sends signals hours, days, or even weeks before it occurs. In this video, we will explore everything you need to know about heart attacks, what they are, why they happen, the early warning signs, and how you can protect yourself and your loved ones. Understanding this information could one day save a life, maybe even your own. What is a heart attack? To understand a heart attack, we first need to understand how the heart works. Your heart is a powerful muscular pump. Every single day, it beats about 100,000 times, pushing oxygen-rich blood through your entire body. This blood carries oxygen and nutrients that every organ needs to survive. But here is something many people don't realize. The heart itself also needs oxygen. The heart receives oxygen through small blood vessels called coronary arteries. These arteries wrap around the heart like tiny highways, delivering blood to the heart muscle. A heart attack, also known as myocardial infarction, occurs when blood flow through one of these coronary arteries suddenly becomes blocked. When this happens, a part of the heart muscle stops receiving oxygen. If the blockage continues for more than a few minutes, the heart muscle begins to die. This damage can be permanent. The faster medical treatment is given, the greater the chance of saving the heart muscle. That is why recognizing the symptoms quickly is extremely important. The most common cause of heart attacks. The most common cause of heart attacks is a condition called coronary artery disease. Over many years, fatty substances like cholesterol begin to build up inside the walls of arteries. These fatty deposits are called plaque. You can imagine plaque like rust building up inside a water pipe. As plaque continues to grow, the artery becomes narrower. Blood flow becomes restricted. Sometimes a plaque can suddenly rupture or break open. When this happens, the body forms a blood clot around the rupture. This clot can completely block the artery. Once the artery is blocked, oxygen cannot reach part of the heart muscle, and a heart attack begins. Major risk factors. Not everyone has the same risk of heart attack. Certain lifestyle habits and health conditions greatly increase the risk. Let's look at some of the most common risk factors. 1. High blood pressure. High blood pressure puts extra strain on the arteries. Over time, this pressure damages the artery walls, making it easier for plaque to build up. Many people live with high blood pressure without knowing it because it often causes no symptoms. That is why it is called the silent killer. High cholesterol. Cholesterol is a fatty substance found in your blood. Your body needs some cholesterol, but too much of the wrong type, especially LDL cholesterol, can lead to plaque buildup inside arteries. High cholesterol greatly increases the risk of heart attack. Smoking. Smoking is one of the most dangerous habits for heart health. Cigarettes damage the lining of arteries, reduce oxygen in the blood, and increase blood clot formation. Even people who smoke only a few cigarettes per day significantly increase their heart attack risk. Diabetes. People with diabetes often have higher levels of sugar in their blood. Over time, high blood sugar damages blood vessels and nerves that control the heart. Diabetes also increases the risk of high blood pressure and high cholesterol. Obesity. Being overweight forces the heart to work harder. Excess body fat is also linked to high blood pressure, high cholesterol, and diabetes, all of which increase heart attack risk. 6. Lack of physical activity. A sedentary lifestyle weakens the heart and promotes weight gain, high blood pressure, and poor circulation. Regular exercise keeps the heart strong and improves blood flow. 7. Stress. Chronic stress can affect heart health in many ways. Stress hormones raise blood pressure, increase inflammation, and encourage unhealthy habits like overeating, smoking, or drinking alcohol. Long-term stress may quietly increase the risk of heart disease. 8. Age and family history. As people grow older, the risk of heart attack naturally increases. If close family members have had heart disease or heart attacks, your own risk may also be higher. Genetics plays a role, but lifestyle choices still make a huge difference. Early warning signs of a heart attack. One of the biggest misconceptions is that heart attacks always happen suddenly. In reality, many people experience warning signs before the actual attack. Recognizing these symptoms early can save lives. Chest pain or pressure. The most common symptom is discomfort in the center of the chest. People often describe it as pressure, tightness, squeezing, burning, or heaviness. Some people feel as if an elephant is sitting on their chest. The pain may last a few minutes, disappear, and then return. Pain spreading to other areas. Heart attack pain often spreads beyond the chest. It may move to the left arm, both arms, neck, jaw, back, or shoulders. This spreading pain is a strong warning sign. Shortness of breath. Difficulty breathing is another common symptom. Some people feel breathless even while resting. Others feel like they cannot take a deep breath. Cold sweating. Sudden sweating without physical activity can be a sign that the body is under severe stress. The skin may feel cold and clammy. Nausea or vomiting. Some people experience stomach discomfort, nausea, or vomiting during a heart attack. Because of this, many people mistakenly think they are having indigestion or food poisoning. Extreme fatigue. Unusual tiredness is sometimes an early warning sign, especially in women. People may feel exhausted even after mild activity. This fatigue can appear days or weeks before a heart attack. Dizziness or lightheadedness. When the heart cannot pump blood effectively, the brain may receive less oxygen. This can cause dizziness, weakness, or fainting. Symptoms in women. Heart attack symptoms in women can sometimes be different from those in men. Women may experience nausea, back pain, jaw pain, shortness of breath, extreme fatigue. Because these symptoms can be subtle, many women ignore them or mistake them for other health problems. Unfortunately, this delay in treatment can increase the risk of serious complications. What to do during a heart attack? If you or someone around you shows signs of a heart attack, every second counts. Immediate action can save a life. Here is what you should do. Call emergency medical services immediately. Stay calm and sit or lie down. Loosen tight clothing. If available, chew an aspirin, only if not allergic. Do not drive yourself to the hospital if possible. Paramedics can begin life-saving treatment on the way to the hospital. Remember this important message. Time equals heart muscle. The faster treatment begins, the more heart muscle can be saved. Ending hook for part 2. Now we understand what a heart attack is and how it begins, but the most important question still remains. How can we prevent heart attacks before they happen? What foods protect the heart? Which daily habits strengthen the cardiovascular system? And what medical treatments can save lives after a heart attack? In part 2, we will explore powerful ways to protect your heart, the best heart-healthy foods, lifestyle changes, and the latest treatments doctors use to save heart attack patients. Make sure to watch the next part, because the information there could help you live a longer, healthier life. Your heart works for you every second of every day. Now it's time to learn how to take care of it. In the first part of this video, we learned what a heart attack is, why it happens, and the warning signs our body gives before it occurs. We discovered that a heart attack happens when blood flow to the heart muscle becomes blocked, usually because of plaque buildup inside the coronary arteries. But here is the encouraging news. Many heart attacks are preventable. In fact, doctors say that a large percentage of heart attacks could be avoided simply by improving daily habits and managing certain health conditions. Your heart works continuously for your entire life without ever taking a break. So today, let's learn how we can protect it. In this part of the video, we will discuss powerful ways to prevent heart attacks, heart-healthy foods, modern medical treatments, and how people recover after surviving a heart attack. How to prevent a heart attack. Preventing a heart attack starts with protecting your blood vessels and keeping your heart strong. Small lifestyle changes may seem simple, but over time they make a huge difference. Let's look at the most effective ways to reduce heart risk. 1. Eat a heart-healthy diet. The food you eat directly affects your heart. Diets high in unhealthy fats, salt, and processed foods can lead to cholesterol buildup in arteries. Instead, focus on foods that protect and strengthen your cardiovascular system. Some of the best heart-healthy foods include fruits and vegetables. Fresh fruits and vegetables are rich in vitamins, minerals, fiber, and antioxidants that help protect arteries. Examples include apples, oranges, bananas, spinach, broccoli, carrots, tomatoes. Eating a colorful variety of fruits and vegetables every day can significantly reduce heart disease risk.
Whole grains. Whole grains contain fiber that helps lower cholesterol levels. Examples include oats, brown rice, whole wheat bread, quinoa, barley. These foods provide long-lasting energy and support heart health. Healthy fats. Not all fats are harmful. Healthy fats actually protect the heart and reduce inflammation. Good sources include olive oil, avocados, nuts, seeds, fatty fish like salmon and tuna. These foods contain omega-3 fatty acids that support cardiovascular health. Lean proteins. Choose healthier protein sources such as fish, skinless chicken, beans, lentils, chickpeas. Reducing red meat consumption can lower cholesterol and improve heart health. 2. Exercise regularly. Your heart is a muscle. Like any muscle, it becomes stronger with regular activity. Doctors recommend at least 150 minutes of moderate exercise per week. Examples include brisk walking, cycling, swimming, jogging, dancing. Even simple activities like walking for 30 minutes a day can significantly reduce the risk of heart attack. Exercise helps by lowering blood pressure, reducing bad cholesterol, improving blood circulation, maintaining healthy body weight. 3. Quit smoking. If you smoke, quitting is one of the most powerful decisions you can make for your heart. Within just 24 hours of quitting, the risk of heart attack begins to decrease. Within a few years, the risk can drop dramatically. Your lungs, blood vessels, and heart start repairing themselves almost immediately after you stop smoking. Even reducing exposure to secondhand smoke is important. 4. Maintain a healthy weight. Carrying excess weight puts additional strain on the heart. It also increases the risk of high blood pressure, diabetes, high cholesterol. Losing even 5 to 10% of body weight can significantly improve heart health. The key is consistent healthy habits rather than extreme dieting. 5. Control stress. Modern life often comes with constant stress. Unfortunately, long-term stress can damage the heart. Stress increases blood pressure and encourages unhealthy habits like overeating or smoking. Learning to manage stress is essential. Helpful methods include deep breathing exercises, meditation, spending time in nature, talking with friends or family, practicing gratitude. Even 10 minutes of relaxation each day can improve heart health.
6. Monitor blood pressure and cholesterol. Regular medical checkups are extremely important. High blood pressure and high cholesterol often have no symptoms. A simple health check can detect these problems early. Doctors may recommend medications or lifestyle changes to keep these levels under control. Monitoring these numbers can prevent serious heart complications later. Medical treatments for heart attacks. Despite prevention efforts, heart attacks can still happen. When they do, immediate medical treatment is essential. Modern medicine has developed advanced techniques that can save lives and reduce heart damage. Let's explore some of the most common treatments doctors use. 1. Medications. Doctors often use several types of medications during and after a heart attack. These include blood thinners. These medications help prevent blood clots from growing larger. They allow blood to flow more easily through arteries. Clot-dissolving drugs. In some cases, doctors give medications that dissolve the clot blocking the artery. These drugs must be given quickly after symptoms begin. Beta blockers. These medications reduce the heart's workload and help stabilize heart rhythm. Cholesterol-lowering drugs. These medications reduce LDL cholesterol levels and prevent plaque buildup in arteries. 2. Angioplasty and stent placement. One of the most common emergency treatments for heart attacks is a procedure called angioplasty. During this procedure, a doctor inserts a thin tube called a catheter into a blood vessel, usually through the wrist or groin. The catheter is guided toward the blocked coronary artery. A tiny balloon at the tip is inflated to open the blocked artery. After the artery is opened, a small metal mesh tube called a stent is placed inside the artery. The stent keeps the artery open and restores blood flow to the heart. This procedure can quickly save heart muscle and reduce damage.
3. Coronary artery bypass surgery. In severe cases where multiple arteries are blocked, doctors may perform bypass surgery. During this operation, surgeons take a healthy blood vessel from another part of the body. This vessel is used to create a new pathway around the blocked artery. Blood can then flow normally to the heart muscle. Although it is a major surgery, bypass operations have saved millions of lives worldwide. Life after a heart attack. Surviving a heart attack can be a life-changing experience. Many people feel fear, anxiety, or uncertainty about the future. But the good news is that with proper care and lifestyle changes, many heart attack survivors go on to live long, healthy lives. Recovery usually involves several important steps. Cardiac rehabilitation. Doctors often recommend a program called cardiac rehabilitation. This program includes supervised exercise, nutrition guidance, stress management, health education. Cardiac rehabilitation helps patients regain strength and confidence while protecting their heart. Healthy lifestyle changes. After a heart attack, lifestyle habits become even more important. Patients are encouraged to eat heart-healthy foods, exercise regularly, stop smoking, maintain healthy weight, take medications as prescribed. These changes reduce the risk of another heart attack. Emotional recovery. A heart attack does not only affect the body, it can also affect emotional health. Some survivors experience depression, anxiety, or fear of another attack. Talking openly with doctors, counselors, and family members can help during recovery. Support groups and counseling can also provide encouragement. Remember, healing involves both the body and the mind. Final message. Your heart is one of the most important organs in your body. It beats more than 2.5 billion times during an average lifetime. Every heartbeat keeps you alive. But your heart also depends on you. The choices you make every day, the food you eat, the activity you do, the stress you manage, all shape your heart's future. By making small, healthy changes today, you can greatly reduce the risk of heart disease tomorrow. Listen to your body, pay attention to warning signs, and never ignore symptoms that could signal a heart attack. Because sometimes the knowledge you learn today could save a life tomorrow.
maybe the life it saves will be your